Welcome back to Fox 51 today. Well, people always think of the doctor when they're sick or hurt, but preventative health is just as important. And here to tell us more is Angela Cabaniss. Good morning.
Good morning.
Okay,
Hi.
So why is this so important, and why should people be getting their annual visits, their annual checkups?
Well, everyone should get annual checkups. They should be coming in before they're sick. They should establish a relationship with their physicians. And basically, preventative health is to promote, protect, maintain the patient's health and well-being.
Okay. And what are some of the things that the doctors look at specifically when they come for these preventative care treatments?
Well, we're looking at, we're listening to the patient's heart and lungs. We're also looking at their cholesterol levels. We're checking labs on them. We're checking their electrolytes. We're making sure that they're not anemic. We're checking their liver enzymes. Basic labs that we're looking at to rule out any kind of complications or any serious diseases.
Yeah, well, for men and for women, what are some important markers, I guess maybe age markers for them to come in and really get things checked out?
As far as for women, women at the age of 21 to 65 need to have a pap smear every 3 to 5 years, or every 3 years actually. Okay. And then men and women need to have colonoscopy screenings at the age of 50. Okay. Men, we can start checking their PSA for prostate cancer screenings at the age of 50 or at the age of 40. And then women, we can check bone density levels, which we're looking for osteoporosis, osteopenia, to make sure they don't have any fractures. And usually we'll start at the age of 65 for that.
Okay. So, let's talk about the relationship aspect. I mean, it's so important to actually communicate with your doctor on what's going on. What are some of the things that maybe the doctor might be able to give us if we're communicating with them versus maybe just going to see them just one time when we're sick?
Yeah. Well, the best thing to do is establish a relationship with your doctor. You want to feel confident. You want to be able to open up and tell them any kind of problems that you have, all the way down to mental health issues. Especially this time of year, I have a lot of patients come in with depression. So you want to be able to communicate and feel comfortable when you go in and talk to them. We're always going to be checking your vital signs. We're always going to be looking for any abnormalities, but communication, open communication is going to be a key to everything. And I always want my patients to come in and feel comfortable when they're coming in and talking with me.
Well, why do you think people are maybe so hesitant to just go in and get a checkup when nothing's going on?
Well, I don't know if it's related to finances.
Yeah.
It could be, they may have financial concerns. They may have a large copay or deductible. And I think some people are also hesitant because they don't want to get any labs drawn, or they don't want to see what kind of problems that could arise from that.
So what are some of the additional things that you as a doctor might encourage people to do? Like if you come in and you see some different results that you might have, maybe some high blood pressure or maybe overweight or whatnot, are there things that you can refer them to?
There are particular doctors that we're going to refer them to. If they're having any chest pain, we're always going to refer them to a cardiologist. But the key, every time a patient comes in, I'm always going to establish goals with them. We're always going to want to encourage exercise. Every patient, we always want to have a patient exercise 30 minutes, 3 to 4 times a week, promote healthy lifestyles, eat healthy, make sure that weight loss is going to be a key to everything. If they're smoking, we want to encourage them, offer them medications that they can hopefully help them stop smoking, and which will help prevent complications on down the road.
Well, and I wonder, as a doctor, do you think it's better safe than sorry? Because a lot of times maybe you think you're having a symptom, you're not sure. Even, an example, like you see a mole and you're like, is this the way it's supposed to look? Is it probably just a good idea to schedule an appointment and come in?
It is a good idea to schedule an appointment. I'm always encouraging the patients to make sure you're checking your body. Look over even your back area. You want to get a mirror. You want to look at your back. Make sure you don't notice any new moles, any irregularities, any mole that is larger than a pencil eraser. We want to always be aware of that. And if you see any changes, let us know. And it doesn't only have to be your skin. If you start noticing that your vision is changing, or you start urinating more frequently, any problems like that, we need to be aware of that. So if we need to, we can refer you to the specialist.
Okay, sounds good. Thank you so much.
Thank you.
Thank you.
Appreciate it. Well, coming up next.